If the general stance of conventional world is you vaccinate, because if we don't vaccinate, all these diseases will come back. We are really, really clear about what we think are the benefits, but what are the risks?
So we know the short-term risks. We know, fever, pain, swelling, redness, not feeling good for a couple of days. So those are the things that have been studied that were known to be causally related. It's not simple, but I do think it is really important, and I do think we need.
Welcome to today's episode of the Medical Disruptor, a place where well-versed humans can ask the hard questions and get evidence-based answers you won't find anywhere else. Our community is always informed, empowered, and science-backed. Every guest on the show must be clinically trained, MD, NPs, PAs, and researchers who want more and expand beyond their conventional education. I'm Dr. E, the NP with a PhD, and I help smart, well-versed humans go from medically gaslit to medically empowered. Today's guest is one of the most talked about figures in modern pediatrics. He's a best-selling author. He's #1 on Substack. And it's not because he's taking a side, but because he's challenging the very idea that we should be forced to pick a side. Dr. Joel Warsh is a board-certified pediatrician trained at one of the most prestigious institutions in the country. Yet he became really concerned by what he saw in his exam room: an exponential rise in chronic illness, autism spectrum, allergies, eczema, behavioral issues, and no one asking the questions of why. Why is this happening? But what makes him a true disruptor is that he's not here to inflame the debate. He's here to reframe it. His message is not anti-vax or pro-vax. It's pro-transparency, pro-discernment, and pro-parents being active participants in their children's health. If you're a parent, a provider, or simply a human trying to understand why chronic illness is exploding in this next generation, this conversation is not about fear. It's about clarity, responsibility, and power. Let's dive in. All right, everyone. We are here with Dr. Joel Warsh. I'm so excited to have you here. Thank you for being here.
Thank you for having me on.
You are a perfect guest for the Medical Disruptor. Just letting everybody know a little bit about your background. You graduated from Thomas Jefferson Medical College. You completed your pediatric residency at Children's Hospital in LA, which is one of the most prestigious training programs in the country. So there you were, on track to like this perfectly conventional pediatrician, but something had to have happened. What was that moment? Or maybe it was several moments. What happened? What made you a medical disruptor?
Yeah, I think it's several moments. And if before med school, before anything, I would say I grew up pretty, I don't know, normal, I guess. I wasn't like particularly holistic minded at all. I played sports and I was pretty active, but nothing specific. And when I went to med school, it was to become a pediatrician. I always loved working with kids, but I would say the biggest thing was meeting my now wife. She's very holistic minded, so that opened up my eyes to a little bit of a different way of thinking and a little bit different way of looking things and eating a little bit healthier. So I think that was really the first eye-opening moment to kind of push me in a little bit different direction. And of course, when you're in training, when you're in medical school residency, especially something like Children's Hospital, which is very, very Western minded, the only things you really ever hear about natural medicine are kind of woo-woo out there. Those people are snake oil salesmen, all that kind of stuff, right? And so that, like, you don't really look into it. You're like, okay, yeah, whatever. That stuff's all crazy. But then, because I got a little more interested, I started to learn a little bit more, and I did some courses on functional medicine and integrative medicine. And as I started going into that, just became really interested because I was like, what? Why are we not learning about this? This is not woo-woo. I mean, there are things that are out there for sure, but a lot of it was just learning about nutrition and learning about exercise and learning more about root cause and prevention. And the more that I got into it, the more that I was interested in it, and the more that I practice it, the more that people seem interested in that. And so that's what's really led me here, I think, to, if you want to call it disrupting or whatever it is, then it's just a focus on prevention, which I don't think is that crazy or woo or even that disruptive, but it is different than a lot of what we're doing today in modern medicine. But I think it's really important.
So, you brought up a topic that I grapple with a lot, and maybe you can give me some insight. So you had someone in your life that was like, hey, there's some stuff out here, and it was enough to create a curiosity for you. Interesting that you came to it from a place of curiosity, because many of my guests come to it from a place of personal journey. They were ill, their kids were ill. So you came from a place of pure scientific inquiry, which I love. So how do you articulate the difference between the stuff that's out there, right? We kind of intuitively know it is, versus the stuff that you feel is really grounded in science? Like, how do we articulate that? I always struggle with that with somebody from the outside. Well, actually, somebody from in the system.
Yeah, to me, integrative medicine means blending the best of both worlds and blending alternative medicine with modern medicine and taking the pieces that are evidence-based, scientific, logical and common sense, and trying to blend those with modern medicine. So for me, I'm not against antibiotics or vaccines or really anything in medicine. I think we've done a lot of amazing things, and we have a lot of amazing treatments that you would have died from, just years ago. So I'm not against any of that. I just think that there's so much out there that's used around the world, that's been used for decades, and that does have a lot of research and a lot of science to be beneficial. And unfortunately, in modern medicine, we don't learn a lot about that, and we're kind of taught pharmaceuticals. That's what we're taught. I mean, a lot of medicine is, here's your diagnosis, or here's your symptoms, here's a diagnosis, here's your treatment. And very little of the time that we spend in training is on prevention, but that's also important. It's also medicine. And there's plenty of literature out there on nutrition and diet and exercise and sleep, and even vitamins and nutrients, and like vitamin C and vitamin D and algebra. There are tons of research studies out there that are completely reasonable, but we're just not really taught about those things very often. So I think if you blend it in that way, it becomes more scientific, and that also helps, I guess, the average doctor, healthcare practitioner to start to bridge that gap, because doctors are good people. They want to help, and if there's good evidence-based information, they're going to do it. But I think a lot of doctors want that specific paper, and I do think the hard part in a lot of natural medicine is many of these topics don't have the depth of research, or maybe the types of scientific papers that they would ultimately love. But that doesn't mean that things don't work or aren't helpful. It's in this modern establishment, certain things get funded and certain things don't. And when you have, sunlight or vitamin D or other things that are cheap or free, there isn't a company that's doing a double-blind trial on those things. So we don't always have that, because the question is who's paying for it, and pharmaceuticals get paid for.
It's such an important thing, and it's really important that it's coming from you, someone from in the system, myself also within the system. And I'm hoping that our audience gets that, because sometimes those sentences that you just said and who's funding it, they sound a little conspiratorial. But I think it's really clear what we're saying here is that we are not abandoning medicine. It's really about expanding it. And I agree with you. I also prescribe when necessary, but almost all the guidelines for chronic illness will start that first line, lifestyle modification. It's just that it's never really developed in the curriculum. It's kind of skipped over.
Right. And it can certainly sound conspiratorial, but I don't really think that it is. I mean, I'm sure there are some conspiracy theories out there, some of them true, some of them not. I'm not against a fun conspiracy theory, but I don't think it really is when it comes to medicine. I think you just have to follow the money and just use common sense. And companies are about making money. They're not about making you healthy per se. Like, that's a good effect if they could do it. But ultimately, let's say a pharmaceutical company, their job is to make money. The CEO's job is to make more money this quarter than last quarter. And so when the research and the journals are mainly funded by companies, and the research, a lot of the double-blind trials are super expensive.
Yes.
Companies that are going to do it are the ones that stand to profit from that. Again, that's not a conspiracy. That's just how it works. And we just have to understand that. And it doesn't mean there isn't science on some of the other natural remedies or vitamins, but the majority of that research is not going to be about those items, because there's nobody to profit from them. So no one to run those trials to show it. And that doesn't always mean that those things are good for you or couldn't be bad. Natural things can be bad for you.
Of course.
But I just think we need to understand that landscape, because it is a very specific landscape, especially in the last 20 or so years, where we've seen this increase in mass production and pharma making more and more money, these companies getting bigger. And so that's a lot of the information that we're getting versus a lot of research on some of these natural remedies, because medicine really moved because of this push towards treatment. And that's great too. We have treatments that are amazing.
Treatments too.
But we also have a chronic disease epidemic, and we need to go backwards a little bit and focus, I think, a little bit more on chronic disease and prevention. We got a lot of focus on treatment of infectious disease, and that's why we're not dying over 40 anymore, right? That's good, but life has been back down, and chronic disease is going up. So I think that we also need to have a little humility in medicine and say, well, there's a lot of things we're doing better, but maybe some things that we're not doing quite as well in the last couple of decades, and maybe let's figure out some of those things and where can we adjust a little bit to decrease infection, but also decrease chronic disease. I think both things.
I love that you put those in those two buckets. And I'm going to, in a moment, take us back on track, but I want to spend another second here on this delineation of the study. So right before we got on this call, on this episode, I was on TikTok, because this is what I do with my life. And there was an MD who just went on a tirade against the concept that mold can be toxic, and just went on a tirade and said there's no evidence-based study, there's no journal. And I think it's really important to delineate between the studies, the double-blind studies that are funded by pharma, that are part of the medical school curriculum, and then some of the still scientifically valid studies that are out there, but that someone like that MD would just not see as valid. And it's really hard, I think. The reason I'm surfacing this is because if you're a layperson, everyone keeps saying, I have a study, I have a study, I have a study. And the other part of it is like this MD was saying, oh, the only reason functional medicine or integrative medicine is showing you this idea of mold is so that they can make money. So like here we are arguing, saying pharmaceuticals making money. And then they in turn around and say, well, the person who's selling you this mold detox is trying to make money. And the person who's selling you the urine test is trying to make money. So I could see where the layperson can really get confused. What are your thoughts on that?
Yeah, I think it's a great point, and I do think you have to consider the money and all of these things, right? I think you do have to consider what someone's motivation is and why they're doing it. Certainly practitioners want to make money, so I mean
Sure.
that certainly is a motivation. And some people might do things that are not always as evidence-based as possible, but that also doesn't mean that there isn't any validity to any of it, or that it can't be helpful or it can't be helpful to some. And there are all sorts of functional integrative tests out there. And sometimes they can be very helpful for patients. Not all of them are as evidence-based as mainstream MDs would like them to be, but also that's sometimes how things get more evidence-based. It takes some time, and there's a lot of stuff that's new around the world that people can use. And ultimately, if people want to go down that route, I think if they understand the risks and the benefits of doing the test, or kind of the ultimate what it can actually show versus what it may not show, or how reliable it is, I think those are kind of important pieces. But I don't know. I mean, mold's out there. I don't see why it couldn't harm some people, right? I think it certainly does. You can ask many people, and it does. And so I think when MDs kind of take this hard line stance, it really is off-putting to modern medicine, because a lot of times it's just, well, I never learned about that, and that's all woo, so it can't be true, until it is. And I think that's not always the best way to be, because the doctors don't always want to learn everything new. But at the same time, there sometimes is reasonable pushback where there are things that are being made as a claim that aren't necessarily evidence-based, or are actually wrong, like just totally wrong. And so you do want some pushback. So I think it's hard because there's just so much evidence out there and so much research, and you're like, oh, someone can put a study to everything, and that's true. But ultimately, we kind of look at the synthesis of the data, meta-analysis and reviews of certain specific topics. But in the short term, sometimes you have to go with, well, here's what the patient's telling me, here's what we found, can we do something about that, and what are the different tests that are available, and try to use the best one possible. But you do have to keep in mind that a practitioner might want to make money and might be selling you snake oil. That's also true. So ultimately, that's where you have to be discerning of who you're going to go to, and that's not always the easiest thing to do.
When I say back on track, I want to get back on track that pediatrics is where you're at, and we know that there's like this, there's a crisis. The rate of eczema is higher, allergies, asthma, neurodevelopmental disorders, it's all skyrocketing. So as a clinician on both sides of this world, what do you think is driving the surge?
Yeah, I think the first thing is it's important to identify it, because it's not even something that we were really talking about even just a few years ago. We certainly were seeing increases, and it has been increasing for a while, but wasn't really on the top of people's minds until this last year or so, when it became, I guess, more political. And I don't think health should be political, but I am glad at least with Mahat and Kennedy and all those and all the individuals that are involved, that they're talking about this, which I think is really, really important, because we are seeing about 50% of kids with a chronic disease, and it wasn't like that just 20, 30 years ago. And like you said, we're seeing skyrocketing rates of everything, and we have to ask ourselves, like, what is going on and why? And I think the first travesty is we weren't really taking a deep dive into this. I mean, obviously some people are looking into it, but nothing that was all that serious.
Yeah.
And it wasn't what I would regard as a major issue. So we don't really know, right? We have theories, but we haven't done, I think, enough of the research to really get a good idea. I mean, I think that we have, at least to me, I think it's the food that we're eating is really crappy, and we're not getting the nutrients that we need. Too many chemicals, too much ultra processed foods. We're surrounded by too many toxins. We're not getting enough sunlight. We're in front of screens too much. We're not sleeping enough. We're too stressed. I think like these are all the reasons, and it's complicated, but I think these things together are leading us to a place where our bodies just can't handle what's going on, and it leads to different chronic illnesses in a variety of different individuals. And that's why we're seeing about 75% of adults have one and 50% of kids. That's not good. Like, it shouldn't be like that. And the rates were like 5%, 50 to 100 years ago. So that's a big change.
Is there any credence to the fact that some people say, well, there's more neurodevelopmental disorders because we're diagnosing more?
I
Oh,
That's
yeah,
certainly true, right? So I don't believe that the rise of autism is because of better diagnosis. I think it's happening more, but I think a part of it certainly is that we're diagnosing it more. There's no question about it. We're much more aware of it. You get better services if you have a diagnosis. There are a lot of individuals that wouldn't be considered autistic before that are now, things that have been grouped in with autism. So certainly a good chunk of what we call autism today was not called that before, and certainly we're much better at diagnosing and much more aware. But also there is a lot more autism as well, especially severe autism. It's about 25 to 30% now, and I don't think there was any way that that was true back 20, 30, 40 years ago. Like, we just don't see those numbers that we're seeing
yeah,
today. The current numbers are like 1 in 31, and in California it's 1 in 12.5 boys. And there's no question to me that if you look around California, there aren't 1 in 12 adult males with autism. Like, that's just not how it is. So I think it's happening a lot more. And I think that there were certainly a bunch of adults before that probably had more mild autism that were never diagnosed that would have been
sure,
diagnosed now. But
not
I think
severe.
severe autism has heavily increased.
That's a really, really strong point. I just want to surface. Like, so sure, if you're going to say, well, yes, people who are on the spectrum with mild, maybe more of them have become included on the spectrum. But the fact that you're talking about an increase in number of severe autism, like that would have been diagnosed somehow
Yeah,
in the
it
past.
would have been called something. I
It would
think
have been
some of
called
it other
something.
thing, but you would have had a mass of back in the day it was called mental retardation. So some of
Right.
that would be reclassified. You have Asperger's that's been classified in as autism now. So there are other diagnoses that have been classified underneath it, but I still don't think that you have these 25% of 1 in 31 with trouble communicating, stimming,
Mm,
not able to function daily. Yeah, that's a big issue. And it's a big issue because the majority of kids with severe autism, majority of kids with autism can't function on their own as an
right.
adult, especially severe autism. And so when you have a growing increase, even if it's just a small amount, it's still a huge burden on society as
Of
they get
course.
older. And the question is, how are we going to help and handle this mass increase of very severe autistic children who become adults in 15 or 20 years? And I don't think we're prepared for that at all when you have such a relatively small, I think, amount of severe autism compared to what we have now.
That is such a solid point. Something I never considered. What's happening to these kids when they grow older in the next generation? How is that going to land in society? It's a fascinating point. Any idea why though? You mentioned the statistics. Why there's more in California? Any theories?
I don't think we know that at all. I mean, the only thing that we do know from California is there's a lot of programs in California and a lot of awareness. So I think that there is a part of it that is better diagnosis in California. I think that's certainly true, given there's been a big push around that. But other than that, I don't think that we know. I mean, there's certainly theories, and you can get as conspiratorial as you want on that topic. But ultimately, we don't know, right? And the answer is we don't know. We have no idea. It's never really been studied. And the first part of even studying that would be to have to agree and identify that it's happening more, because as of right now a lot of what is discussed around autism is, oh, it's just better diagnosis. So if it's just better diagnosis, there's no real reason to look into the reason why it's happening.
Ah,
So I don't think
interesting.
that we have that. And now you're getting some of the first discussions around root causes and, Tylenol and folate receptor deficiencies. And those are the things that have been in the news lately. And obviously there's some pushback around that. But ultimately, there hasn't been a lot of discussion in the mainstream, at least, about root causes and looking into what might trigger it or some. I mean, there's certainly been some research on genetics and environmental toxins and paternal and maternal age. So these are all things that we know are related, but I still think that there is at least a subset of kids that is some sort of environmental exposure, toxin,
Hmm.
maybe combination of things, and we don't really know. We don't know, and hopefully that's something that's going to be coming out of the new administration. Will be hopefully not making wild claims, but yet looking into and saying, like, well, here are the things that we've identified. Here are the top 10 things that we think might be related. Let's go get the research on some of those a little more. And they
Yeah.
definitely have identified or put aside some money to study autism. And I don't think we've put the money aside to study it in that way ever. So, hopefully we can start get some answers.
Okay, here's a commercial break that's not really a commercial break because I'm not selling anything. I made you a free guide that will show you exactly how to track patterns, document symptoms, and get taken seriously. I called it Build a Case, the skills you already use everywhere else, but now you're going to use them here. Click the link in the description to get your copy. Now back to the show.
And I don't want to make this talk just about autism, but I think it's really reasonable to say that if we're taking these young little munchkins with developing systems and we are assaulting their systems with more toxins than ever, whether it's their environment or their food, it's a reasonable conclusion that something is going to go awry. And it doesn't have to be, um, you know, severe autism. It could also just be other more subtle chronic illnesses, right? It just, so even without a study, it just makes sense. And sometimes things are okay to make sense without a double-blind study. Like, it just makes sense.
Yeah, I mean, to me, it makes sense that a lot of what we're seeing is inflammation in different areas, different ways, the body responding. And at some point, with too many chemicals, too much of a toxic exposure, whatever it is, it kind of falls off a cliff, and then it expresses itself in different ways. For some kids, that might be eczema. For some kids, that might be autoimmune conditions. For some kids, that might be autism and brain inflammation. Like that is, I think, what we see. And all of these things are complex and multifactorial. And I think certainly for autism, it's many different things. I don't think it's just one thing.
Sure.
And I think that there are certainly kids with autism that is completely genetic, and then other kids which is completely environmental. And I think we owe it to the kids, especially for severe autism, to continue to look into this and see if there's anything that we can identify that triggers it or makes the symptoms worse, and ultimately hopefully help those kids to function better, or maybe even prevent some of it, some autism, if it really is just a toxic exposure. But we won't know unless we look and are willing to ask those questions, and willing to go past it's just genetics, because it just doesn't make sense to me that's just genetics. It's too much of an increase in too short of a time. And I'm sure genetics plays a factor in how susceptible you are.
Sure.
So certainly some genetics probably make you more susceptible, but I think it's genetics plus the toxins, and that's what to me makes the most sense in terms of what's going on. And we need to unpack that, and I don't think we ever really truly have yet.
It's interesting that where we're stuck right now is even being willing to have the conversation. That's a really good point. We haven't even agreed that it's a problem yet. So, like, even getting to it. So let's talk about the parents who are like, I'm sure you do still practice.
I do, yeah.
Okay, so the parents, they're coming in and say, I'm doing everything right. They're following all the guidelines. They're keeping up with the checkups. They're vaccinating on schedule. We'll get to vaccines in a moment. But their kids are just unwell. Like, the parents are like, my kid's always sick, or there's always runny, or they're just like, so what do you tell the parents who say, listen, I followed all the rules and my child is still sick?
First of all, there's a lot of genetic variability. So some kids are going to be, you can do all the right things, whatever that is, and you can still have illness. And I mean, minor illnesses is normal, right? And I think you also have to have an understanding of what's normal versus abnormal. Having little colds every now and again is pretty common, and most kids get a bunch every year. So I think a lot of times parents think their kids are getting more sick than they're supposed to, but really it's just actually normal. And I try to remind parents that doing everything right doesn't mean them never getting sick. What you're aiming for is for them to be able to heal relatively quickly, not get super sick, not end up in the hospital.
No, I'm sorry to interrupt you, but that's a really good point. I tell my patients all the time, I'm like, yeah, Jimmy got sick 4 times this year, but Jimmy recovered 4 times this year.
Right. Exactly.
Like, that's a really good point. Yeah.
And sometimes I just try to remind people of that. But also a lot of times, we think we're doing everything right, but I mean, everything right changes. What does that even mean? And a lot of times, even the best case scenario for a lot of people is still problematic. I mean, you could be eating healthy, but maybe you're not really eating healthy if you had really somebody looking at it, or maybe for your child, whatever you're doing isn't the right food for them. So, like, for example, I'm thinking like gluten or dairy, right? So you could be eating super well, but your kid's sensitive to gluten and you're giving them a lot of that, so it's causing issues, or dairy. So sometimes it's just thinking about some of those things, or like you mentioned, environmental toxins, mold. Like, maybe there's something in your home, something in your environment, something you're spraying, something you're doing where you think you're doing all the best stuff, but maybe there's something else that they're exposed to that's going on. So ultimately, it is a little bit of detective work and sometimes thinking outside the box, but the starting point is understanding what's normal and not getting too worried. And sometimes that is where parents get stuck, is they think that they're doing things wrong when their kid is just a normal kid and gets sick a few times, and that's what you would expect. And they're growing appropriately and happy and playing, and they get a couple colds, and you're like, well, they're in daycare, like they're gonna
Yeah,
get
what do you expect? But I think also to the point of those who have some chronic illnesses, um, the idea that we checked everything off in terms of medical guidelines, which is very important, going for your checkups and doing your lab work, etc. I think many parents, just as they're not yet been exposed to uh, different potential root causes for themselves, they haven't opened their minds that that could be the thing also. So like, well, I did everything right. How could it be? But it's like, did you do everything right? Like, do you really think that, eating processed foods is okay if it says gluten-free or low calorie on it? Or, do you think that it's okay, to be exposed to things, and what are we lathering on our kids? And so this idea that maybe they're just not expanding parents' minds that just doing everything right according to medical guidelines may not be enough.
Yeah, and expanding your mind on what is right or what is enough. I mean, even as a practitioner, I didn't learn most of this stuff even in med school, right? So
Yes.
it's like a lot of it is learning as you go, and things change so much, and you think you're doing great, but it's like, even in the best case scenario, a lot of our food is not that great. So even if you're not buying a ton of ultra processed foods, but you're like, let's say go to Whole Foods or something, like a lot of the food is still sprayed in all sorts of crap.
Sure.
And it's still, even in the best case scenario, even if you are cooking, I mean, what are you cooking with? And so sometimes if your kids are more sensitive, like, you need to see if you can find like a specific farm or local produce or a farmer's market. Like, that food is just different. The nutrient profile is different. And obviously not everybody can do that. But I think a lot of us think that we're doing everything right, when the reality is that the best that you can do still has a lot of problems in modern society.
Yes.
And that's frustrating, but I think that's a big issue, and a big reason why we're here in the first place with this chronic disease epidemic is, or just our system with our food and the toxins is so backwards right now, and so difficult, and it makes it really hard for the average individual in America to even eat healthy at the best case scenario. Even if you do have money and you can afford it and you can do that and you have access, you still have your food that's sprayed in all sorts of crap, and it's, comes from Mexico, and it was picked 3 weeks ago, and it was flown across here or some other country, and you're like, okay, but that's not how you're supposed to eat food. It's supposed to be picked like yesterday, and you're eating food 3 weeks later, and it's sprayed in all sorts of stuff anyways to keep it from going bad. So maybe it's organic, but that doesn't mean it wasn't sprayed in all sorts of other crap later. So yeah, it's just, it does become a little bit overwhelming, and I try to keep it as simple as possible and trying to do as best as you can. But that, I think, sometimes is a realization for some parents is, okay, well, you think you're doing everything right, but like, these are the kind of things you do have to think about. You may be doing better than some, but that may not be enough for your kid to stay as healthy as you want them to be. So it's a nuanced.
It's a nuance, but also it's like, for those who are like, well, it's just too much. If everyone's thriving in the family, then you don't have to go crazy, right? This is just for the sensitive kid. Things are not getting better. This is who we don't have to do this if everyone's fine. And I think for those who don't suffer, they kind of like, oh my God, this is so extra. God bless you that you and your children aren't suffering. But once your child is suffering, this is when you have to kind of go layer by layer. And
I just want to add before we go on that, and I think it's important to realize that little changes make a big difference, and so you don't have to do everything. But
like what?
We can all do a little more, and I think that one big part of that is just recognizing that health is important. And a lot of times we value money, and we value speed, and we value convenience, and oftentimes what gets left out of that equation is health. And the more convenient, the cheaper something is, generally the worse it is for you. And so sometimes I think we need to prioritize health in that equation to the best of our ability. And I know that not everybody has the same funds or can do the same things, but if you are making decisions with health in mind, then you will move the needle forward a little bit. And that just may mean looking at 2 bags of chips and looking at the ingredients and picking the one with the better ingredients can be the exact same price. When you're buying things for your home, cleaners, maybe fewer things that have a long list of ingredients, and just buy some vinegar and make your own. Or maybe you cook once a week and you move to cooking twice a week. Like, whatever it is that works for you, it doesn't have to be this massive change, but we all still can put health back into our mindset when we're making decisions, especially when it comes to food or products. And that will, I think, lead pretty far for most people and be enough for most people.
I think that was a really strong point, saying that it's about deciding that health is important. I recently, one of my colleagues, so I'm not talking people who really just like don't have access to things. We understand that, social determinants of health, but an average person, and she kind of went on a health journey for various reasons. And she turned to me a few months later and she's like, I've never spent this much on my health. It wasn't that she went like extravagant, but just like she made changes and she reprioritized where she's spending her money. It's the same amount of money because eating out is not cheap these days, and buying knickknacks and things you don't need on TikTok shop, right? Those add up. But just reallocating it to health, whether it's an additional supplement or better running shoes. I'm not talking about extreme things, but deciding that health is a priority over, other types of consumerism, just deciding to spend your money in health is the central decision. And then
I think so. I think that is a central decision. And then, maybe you prioritize your bed or what your sheets or what you're sleeping in, you're in there long time, or maybe you're spending a little more money on groceries like that. Yes, not everybody can do it, but if you can, maybe that one dinner out isn't as important as going to the farmer's market and getting a little better produce that week. Like that's what everyone has to make a decision. But ultimately, if you are deciding with health in mind, then some more of your decisions will be based around buying healthier things, and it can be more expensive. It's not always more expensive. There are plenty of things you can do that are healthier that are less expensive. So it doesn't have to just be about expense. But I think that sometimes it can be more expensive. But ultimately, to me personally, if I'm going to spend money wherever I can, something that has health in mind for my family is really important to me. And if there's one thing that I think is important, it's the food. And certainly for me, I prioritize buying healthier food and going to farmers markets as much as possible and buying as fresh produce as possible, which means going more and spending more. It just does. But that to me is important, and where I prioritize my money, and other things I don't do as much anymore. It's just how it is.
Yeah, I love that so much. So now I want to we're in the middle. We've laid the groundwork. Anyone listening knows that this is the yes and community. This is the community that lives in both worlds. And this brings us to your book called Between a Shot and a Hard Place, where you don't argue for or against vaccines. You argue for informed, individualized decision-making, which I love. So there has to have been a moment somewhere in your practice where you realized kind of what you learned about vaccines wasn't the whole story. Can you share that?
Yeah, well, I think the whole topic of vaccines to me is very interesting, and I would say the last place I thought I would be today would be talking about vaccines or writing a vaccine book. It was like farthest from my mind 10 years ago. And I think that if you go back to training, again, back to the Children's Hospital and that, you're not really taught a lot about vaccines. Like you don't really think about it. You kind of learn, well, here are the horrible diseases. Here's how much better things are.
Yes.
Here are the vaccines. Here are the schedule. A little bit about the ingredients, but very minimal. And that's kind of it. And you're like, okay, great. These are the best things ever. Hurrah! Like let's go do our vaccine schedule, and you do it. And that's it. You don't really think about anything else. You don't really question it.
So true.
You just go. And that's the way that I kind of thought of vaccines back then. And I would say, again, there's not really one exact moment for me, but this is more of a culmination over years. And the reality is, once you start working in integrative space, parents have a lot more questions about vaccines. And so I was kind of forced to learn more because I was just getting a lot of questions and a lot of questions that I didn't know the answer to, or people were asking about things I had never heard about before. So I had no choice but to get more educated so I could answer questions reasonably for patients in my office that they had them. And I had been doing that for almost a decade, and of course the topic of vaccines was always so controversial and so censored, and it wasn't even something that you could really talk about online. You say the word vaccine, your platform gets
oh my god
banished.
I'm still scared to talk about it.
Yeah, it was nutty, and I mean still is to some degree, but it's a lot better now, thankfully. But it was insane, and so I was getting really frustrated because people were asking me more and more questions, whether in the office or online, but I couldn't really talk about it, and I really wanted to. And then the pandemic happened, and everyone got super frustrated, and the messaging changed. And ultimately, during that time, I decided, no, I need to talk about this. I want to talk about it. I think we shouldn't have censorship like this. I think we should be able to have a discussion around vaccines, and the best information should win ultimately and be presented, and not just kind of silence one opinion, even if you disagree with it. And so that's what led me to start really researching and learning, because I said, ultimately, if I want to write a book and I want to talk about this, I have to be as educated as I possibly could, because it's obviously so controversial, and so I need to be able to speak about this with an education that's as strong as it could possibly be. And so that's what I did, and then I wrote the book, and then it came out this year, and I guess thankfully for me, this year is very different than in the past in terms of vaccines, and the conversation has opened up a little bit, and people are much more willing to talk about it, and I've been able to go on a lot of things, and nothing's really getting censored, which is good.
Yeah.
And I think for me, just to kind of set the stage, so I'm not against vaccines. We do them in the office. I don't believe in forcing anybody to do anything. That's just my personal belief. I feel like my job as a doctor is not to force you to do anything. It's to give you information and education and help you to make the best decision for you.
100%.
And I think that should translate to vaccines as well, just like everything else that we do. And I have patients in my office that do the regular schedule. Some do a slower schedule. Some don't do it. Most do some vaccines. And that's really my personal belief. And with the book, I did not write it to try to convince anybody to do anything or not. It really is
Exactly.
about trying to open up discussions. And I really wanted the book to be a sounding board for information and for questions, and the questions that parents have over and over again, and try to do the best that I could to find the balanced information and kind of the information on both sides, and not pro-vaccine or anti-vaccine, but just what kind of both sides said. And I think that is helpful to parents who, a lot of them are not against vaccines, but just somewhere in the middle, and I've heard like, oh, I'm worried about this ingredient, or I'm worried about this. And I wanted to dive into each of those topics and try to talk about what we do and don't know.
So where's your general stance, right? Not ingredient by ingredient. So if the general stance of the conventional world is we vaccinate, because if we don't vaccinate, all these diseases will come back. And then the anti-vax is like, absolutely, we're not doing any of this, which is problematic. What's your general stance? Like, for me, it's very much like, it depends what's going on with the child. It is one more thing that the body has to process. And we have to have that conversation about what this particular individual can process. What's your general stance around this?
Yeah, I mean, my general stance, it's honestly, it's the same in the office, in the book, or when I have discussions. It's a personal choice. Ultimately, I think the CDC schedule, if you're in America, is the standard schedule. That's what's recommended. I think it would be extraordinarily arrogant of me to say, oh, Dr. Joel knows better. You should do this differently. What does the CDC know? Like, I think it's been studied for a long time. That's the recommendation. And that's what's ultimately generally recommended to the population. Anything outside of that becomes a personal choice, and something that you have to weigh the risks and the benefits for yourself and with your practitioners, and figure out what makes sense for you. And that to me is what I think we should be doing more of these days. It should be more of individualized medicine. It should be more thinking about what makes sense for us, and what makes sense for our child, and in our specific situation, and weighing the risk versus the benefits. And that's, at least in the book, how I tried to work things through, and really start the first couple of chapters going through, like, what are the diseases? What is your risk of getting the disease? What happens if you do get the disease? What do we know about the vaccines? How much do they protect you? Or what? Because I think it's not simple. Like, I think we've tried to simplify it so much to vaccines are good or bad, and I don't think that's a great place for it to be. Like, nothing is fully good or fully bad. Nothing doesn't have risks, or doesn't have, these things have benefits. Like, we know they have benefits. So I think the question for you is, what is the benefits you might get from this vaccine versus what are the risks, and what do we know versus what we don't know about the risks? And the problem, I think, and where there's a lot of discrepancies, I think we don't have the best information around long-term risks of vaccines and the cumulative risks of vaccines. And I think that's a very important piece when you're making that equation, when you're trying to decide what are your risks from a product. And that's what I think we need a lot more research on. And we should be focusing a lot of our attention in modern medicine to try to get that, to understand, not to say we shouldn't do vaccines, but maybe there are ways we can do it safer or better. And if we don't ask those questions, we're never going to do that.
And I totally agree with you. I guess I would love to know what you think globally, right? Because we are really, really clear about what we think are the benefits, but what are the risks?
Well, I think that's the question. We don't know, right? So I think we
But
have
how
a
do you
good
have that conversation with your patients of risk reward? You must have landed on some risks.
right. Well, I mean, we know the risks that we know, right?
What do we know? What do we know?
Right. So we know the short-term risks. We know, fever, pain, swelling, redness, not feeling good for a couple of days. The basic stuff that you're told when you get a vaccine. And then in terms of the things that are evidence-based, we know that there's a possibility of seizures, Guillain-Barré syndrome, which is an autoimmune condition, encephalitis, brain inflammation, So those are the things that have been studied that were known to be causally related, but mostly everything else hasn't been studied enough to say one way or another whether it does or doesn't. There is some research out there, but not a ton. There's very little prospective research. And the reason for that is if you think about the way that vaccines are studied, they're mostly studied before they hit the market. They're studied by the companies and they're studied for a few months, maybe a year, maybe two if you're lucky, but mostly it's a few months. There's nobody really studying these things for 5 or 10 years. And a lot of conditions that we have, like say the things we're talking about, autism, autoimmune conditions, allergies, those are things that probably develop over a long time. And so to have an understanding whether those things are related or not, you would have to study it in that way. And oftentimes we don't really do that, or some of the only research we have is kind of epidemiologic research. Generally, it's not even vaccinated versus unvaccinated kids. Right. So we don't have the best kind of research for that. So we can only really extrapolate. And so the answer is we don't know. And I think knowing really changes the equation for us. For me, it really changes the equation. So ultimately to your question, like how do you tell parents? Well, you have to decide based on what you know. And that's why I tried to write out what we do know. But if we don't know the risks, our goal should be to push to get that information. But you still have to make a decision today based on what we do know.
Right. What about, don't we know with the COVID vaccine, don't we have a much more robust list of causal side effects than we have on any other vaccine?
In some ways, yes. I mean, it's newer. We've done a little bit more research. There's been a lot more attention around it. But I mean, there's really not a lot in the way of vaccinated versus unvaccinated trials, and we're not really following people forward for that. So that's really the only way you could know. We definitely know a little more about myocarditis because that was something that was caught. But there are speculation around fertility issues and some things I guess and some things I know. But I think the weight of the evidence is that maybe it can affect some women with fertility, but it's hard to know. I mean, there's a lot of discussion around cancer.
What about autoimmune flare-ups?
Autoimmune, all these things. I mean, they're all discussed, but they're also discussed with everything. But ultimately, a lot of the research is more short term and generally epidemiologic in nature versus an actual trial, which you would really need to have the best kind of understanding around this. And so we just don't have that. And I think ultimately what we need is prospective trials that follow people forward and have people volunteer which group they're in. If they don't want to get vaccines, they could be in one group, and people that get vaccinated in the other group, and you follow them and we'll see what happens. It's obviously not the best kind of research you could possibly get, but it's as good as we're going to be able to do.
And also, who would be incentivized to fund that kind of study? That would be a problem.
Right. Well, that's the thing, is that's why I think a lot of it hasn't been done, because pharma's not going to do it, right? Sure. And that goes back to, again, the issue we have with the research is a pharmaceutical company going to go and study their products now to find a problem to take it off the market? Like, they're obviously not going to do that. So you would need the CDC or some big organization or really wealthy people or crowdfunded or whatever to actually do this kind of research. And to follow people forward is extraordinarily expensive. You're talking probably billions of dollars to do a study over probably a decade. So it's not simple, but I do think it is really important. And I do think it's very important.
Would you say that it's reasonable, though, if we started the conversation earlier about all the things that children are exposed to and how that's affecting them chronically, would you say it's reasonable to include possibly the vaccines in that list of things that can overload a system?
Yeah, I don't see why it wouldn't be. And that's the thing that boggles my mind sometimes is we're talking about like biological pause. Oh, it could never be. And I'm like, that doesn't make any sense, because we know they cause seizures and we know that they cause autoimmune conditions like Guillain-Barré. So why couldn't it cause some of the others? And it's possible. I'm saying that it does. I'm just saying a vaccine is literally meant to stimulate your immune system in a positive way, but that doesn't mean for some people it couldn't have negative effects, or your genetics, or whatever the situation, or maybe cumulative effects, or maybe you have a certain detoxification issue, you're premature, your kidneys don't work as well, whatever it is. Like there are certain individuals that have susceptibility to anything. Like, think about people with a peanut allergy. Like, somebody can walk by a peanut, have a whiff, and they have an anaphylaxis. It's like, so you can say like, oh, there's only so little ingredients in a vaccine, it could never cause a problem. Like, that doesn't make any sense. Like, for some people it could, right? And the question is just how many people does that happen, and how much worse is it getting when we're adding more and more vaccines? And that's not unreasonable questions from a parent. I just don't think that those things are outside the realm of logical, and I think that modern medicine is doing such a disservice to itself by not being willing to have these conversations.
Yeah, I agree.
And we're getting to a point now where medicine's actually causing the very thing that they're trying to prevent, which is hesitancy in vaccines. And you have the most people not vaccinating, the most people that want exemptions. You have the lowest rates of trust in modern medicine, the lowest rates
100%.
of trust in vaccines that you've ever had, because I think the conversation's been shut down, and because of COVID and the distrust around what happened during COVID and kind of feeling like you're forced to do things. And there's this pushback now against all of science,
Absolutely.
all of vaccines, and that's a big problem. Like, there are good parts of vaccines too, of course there is. So I think that we're missing the boat on that, and the answer is to have discussions and debate, not to shut it down.
Shutting down these conversations in the exam room is definitely what's causing more hesitancy. Because if you're just like, shut up and take it, for the person who is not, anti-vax, you kind of force them to be anti-vax. You're like, well, a lot of people who I don't think would be in the anti-vax group, because they're hesitant and unsure and can't get answers, end up going to that camp because there's nowhere in the middle.
Right, exactly. And you're like, well, if you're lying to me about this in COVID, what else are you lying to me now? I don't trust anything. I went to your office and you're kicking me out because I want to ask questions. It's like, okay, well then, is there something I shouldn't trust? Like, what am I missing here? And I think that's happening a lot.
That's so true.
And I think that's such a shame, because we should be able to have discussions, and I don't care. No one has to believe me or trust me or listen to me. Like, and I don't have to be right about anything. Like, I'm not trying to be right. I'm trying to have kids. So if there is information that's going to change my mind, great. Like, I don't care. That's wonderful. Like, I would love to see 10 prospective studies and them all show vaccines being perfectly healthy and causing no issues. And that's great. And that's going to be the information that's going to make people comfortable to do it. But right now, you don't see that. You see no prospective trials. You don't see vaccinated versus unvaccinated studies. You see more and more questions without answers and a lot of pushback. And that is not a good direction forward when you're talking about trust, when you're talking about a system that's already lost trust. You're not going to gain it back by digging your heels in deeper.
Yeah.
You have to listen to the concerns and say, all right,
this is like basic relationship advice.
Here's what we know. Here's what we don't know. Here's what we're going to do to try to understand that better. And that's okay. Like, doctors don't have to know everything. We don't have to know everything about vaccines, but if we acknowledge the blind spots, then we say, all right, well, we're going to set up some trials to look into these things. We're going to have some better answers in 5 or 10 years. We still think you should do it. But we're not 100% sure about some of these things. Then I think people would have a lot more trust in that than, oh, they're just safe and effective. Like, when you hear safe and effective and like propaganda over and over again, that's just a very weird place to be. And it's very weird from the pandemic, where you're like, this is something that was just said over and over again. Like, how can you know that something's safe if it's only been a few months? Like, you could say it seems safe based on what we know.
I think so.
You don't know what happens in 5 years, and you don't have to. No one expects you to. But when you force people to do things,
absolutely,
say that you know something that you don't know, then you lose trust, and that's what happened, and that's why we have almost no trust in modern medicine anymore. And that's absolutely a bad place to be.
It's a bad place to be. You mentioned when parents are kicked out for asking questions. One of the harshest things I saw, because I sit on the board of the hospital, was letting go of nurses who refused to take the vaccine. I mean, the nurses that were there frontline, endangering themselves and their family, and then being told that they can't come back to work until they got this. That was really, really harsh, and really changed the dynamic between nursing and hospital administration as well.
Yeah, well, I think that's one of the biggest mistakes in medicine ever. I think forcing something that's emergency use is just, there's just no reason to have had to do that. I think that we failed on natural immunity, which a lot of people had, and there was no reason that we couldn't have acknowledged that. And we failed to force people to do something that they didn't necessarily want to do, especially if they already had it, or already had one and like they need to get 3. And I think that there is something to be said, especially in an emergency when something's new, to allow people to do what's best for them and to choose what they feel like is right. And especially as we started to understand that you weren't stopping transmission, then that even makes less sense that you would force anybody to do it at that point, once we already knew that. So I just think that that's such a failure of public health messaging, and such a failure of doctors and staff in general to kind of push a narrative that wasn't real, and that's really pushed back on medicine in general. And it's not just in hospitals. I mean, it's just, there's this mentality that vaccines can never cause a problem, and that's just a bad. It's just, it doesn't make any sense. Like, it's a religion, and it's not to say that they cause like a million problems, but to say that it never does, it's such a double standard. And I go back to, like, I've talked about this many times, like, okay, amoxicillin, for example, your kid has an ear infection, and you're like, oh, here's amoxicillin. 5-7 days later, the kid has a little bit of a rash, and it may not even be from the amoxicillin, it might just be from a virus or whatever. And you're like, oh, amoxicillin rash, never take amoxicillin again the rest of your life.
Yeah.
the kid like gets a vaccine and has a seizure the next day, and you're like, it's probably a coincidence. Don't worry, get one another
Oh
month
my
from now.
God, you're so right.
And it's such a weird double standard. And again, it's not that necessarily the vaccine caused it, but we have this like really quick jump for any sort of medication. You like any sort of symptoms, okay, never take that again. But for a vaccine, it's just a
That's a
coincidence,
really strong point.
and that's just not like, why don't we also take that into account for kids and have a little bit more leniency?
So
And I've seen
interesting.
it before. I've seen it with kids that like they went to the doctor, had a very serious reaction at 2 months, put them in the hospital, like a super fast heart rate, and then they're like, it's probably coincidence. Okay, 2 months later, back to the doctor, they convinced to do it again, even though they were like, I don't know. And then same reaction happened back in the hospital, and after that, 6 months, no, we want you to do the vaccines again. It was just coincidence. And it's like, I don't know,
I
like,
don't think I want to do this again.
do this again. I think they're having bad reactions. Like maybe it's coincidence, but I don't know. Like these things happened twice the day after. They never had any other
Yeah.
issues. Like, that's too much coincidence. And this is a family who has an older kid who's fully vaccinated. So
Right.
anything.
That's the audience I'm talking about.
That doctor told them, you cannot come back if you don't vaccinate. We're not going to take you. We want to take vaccinated kids. And I talked to them. They were crying and
because you're shamed. You feel shamed.
And I'm like that's insane. Like where did we get to the point where like you couldn't have a reaction and you couldn't have some compassion for a family in this sort of situation where like maybe this is the one family where you're like, okay, maybe there's a reaction, maybe there's some genetics, maybe there's something. This could go a little slow. Maybe we'll leave it for a few months and come back. Like the other kids can get vaccinated to protect this kid, but like maybe this kid's having a reaction. I don't know, like two things, the same thing the day of that they never had before. Like that's enough to me to say, well, okay, maybe it's coincidence, but probably not. Like,
oh my God, as if it was a peanut, they would never eat a peanut again. The whole family wouldn't eat anymore.
So I don't know. I just think there's this weird standard, and unless medicine changes that, there's going to be more and more stories like that, and that's just so heartbreaking because it's not someone who's anti-vax. It's someone who literally went to get vaccines.
Yes,
like they're not anti-vax at all. They just feel like their kid is sensitive, and they feel like it's not the right thing for them, and we should be able to support that as an institution.
And that's the family that ends up going to become anti-vax because they have nowhere to go.
Right, or they get forced to do it again. Their kid has a much more serious reaction. Hardcore anti-vaxxer and pushback.
Yes,
and that was never needed to be because that kid was just not the kid that should have gotten him in the first place.
Absolutely. A question for you though, because we mentioned transmission. What about the fact that if we just kind of say what you say, which is like, listen, everybody should make their own decision and we shouldn't push it. What do we do for that? Like because the ultimate response from inside is, well, how do we protect society? And how do we protect the people who can't get vaccinated? And how do we protect, the babies and the pregnant women? How do we answer that?
Yeah, I think that's a very important question and something that needs always nuanced discussion when it comes to public health and kind of, I guess this is a term like the social contract or protecting other people. And there's certainly no question an aspect to some of the vaccines when it comes to that. And I think the first thing that needs to be understood is not every vaccine protects other people. A lot of them actually don't. They're for you. So there's no real herd immunity for a good chunk of the vaccines. And so those are things which should, again, be personal decisions because do you want a protection or not? It doesn't really protect anybody else. But there certainly are some vaccines, like let's say measles, where there is a protection for other people. And if enough people get the vaccine, then there's really nowhere for the disease to go. And so ultimately the risk to other people is lower. And that's a real thing. I think it's important we want to protect other people, but at the same time, I think it needs nuanced discussions because there are a lot of things that we do to protect other people. And there's a lot of other things that we say it's too much of a risk for me. And so, I get to make a personal decision. And so where that line is for everybody, I think is a little bit different, and ultimately forcing things to me isn't the right answer. Yes. And at least based on history thus far, there hasn't really ever been a need to force people to do vaccines in the modern, last few decades. People just do it. Yeah. Most people with education do it. There are a lot of places in America, around the world, that don't force people to get vaccines, and most people still do it. The rates are still pretty high. I mean, the rates of unvaccinated kids totally are like 1%, so it's not very high. I think there would certainly be a discussion if you start having like 50% of people not getting vaccines, then that would probably change the equation. But at least as of right now, most people still do it. So I don't know that forcing it is really needed. Taking away people's autonomy to make those decisions is the right thing to do. And also, as you get more and more vaccines and you increase the risk, at some point, there's a risk where you're like, I don't want that risk for my kid, and you shouldn't have to do it. And everyone's line's different, but just imagine, you could say, well, you have to have your kid give a kidney because another kid needs a kidney. Well, that helps a kid that could potentially die. So you could be forced to do that. You could say, well, we need everyone to plug their brains in to this machine because that's going to protect everybody. Like obviously that's extrapolation, but like there's a line for everybody, and you might be okay with your kid being forced to do 3 vaccines, but what in the future if there's 100 vaccines or 1,000 vaccines, or the new rules are, we got to give 1,000 vaccines to a kid on day 1 of life, and you're like, I don't really want to do that. But no, but it protects everybody from all the diseases, right? So I think everyone has a different line, and for some people that line's already crossed where they're like, there's just too many, I don't feel like the risks outweigh the benefits and I don't want to do it. And I just don't think that's a very simple answer. I don't have an answer to that question fully, because I think everyone's going to have a different answer, but
Yes.
To me, the answer is it's not as simple as people want to make it out to be. And I think nuanced debates on that are really important, because ultimately, if you're like, no, like everyone needs to just get one to protect everybody else, then you don't really understand the complexity of it. And you're not compassionate to the people who, maybe there's a situation where a kid is super sensitive
Right.
and has had issues, or maybe had issues with vaccines in the past. And you're like, well, this is a kid that needs to get vaccines to protect other people. And the parents like, no,
Sacrifice my child for the community.
my kid from the vaccine. Like, I need to protect my kid because they're sensitive. They had reactions. So that's why I think just blanket statements with this don't work.
Yes. Love
Because
this.
it really does not go to the nuance and the individual risk, which I think is really important of a consideration. So again, it's like it's easy to say, oh, this anti-vax is crazy. We don't want to. No, I don't want anybody to get measles. I don't want anybody to die. I mean, not anything. But I want to minimize risk of infection, but also minimize risk of complications and chronic disease. And I think 2 things can be true at once. And if we can't have discussions like this, and we can't even acknowledge that vaccines can cause an issue, same thing like autism. If you can't acknowledge that there's some issues there that could be improved upon, you can't make them better. And I think we should always be striving to have the best possible vaccines with the lowest possible risks, and we could be making them better, and we could be changing the technology. And you haven't seen a lot of change in technology in the last 20 years for the basic vaccines on the regular schedule. And I think that's because there's no push to do that. And I think we should be striving to reevaluate that, and potentially, maybe there's like an oral vaccine, which you could just drink it like some of the ones, and that would be enough and it would decrease your risk. Or maybe there's a skin patch. I don't know what the future holds, but what we have now isn't necessarily the best technology for vaccines we're going to have in the next 100 years. So I think we should be able to talk about that.
I love that. Such a strong answer. I agree with every single line that you said. Let's do some takeaways from our audience, because we gave them so much information. I know that you often say for parents that they don't need more fear. They just need better discernment. So for the parent who's listening, who's overwhelmed by conflicting advice, whether it's on vaccines or chronic illness or mold or whatever we talked about, what's like a mindset shift or an action that you want parents to start doing to become more active participants in their child's health journey?
I mean, I want them to become more active participants. I think that's the
thing.
big thing to actually, we said it before, but like to be active on your decision making, to make health a priority as part of your decisions, and to try to decrease the fear around every sort of decision. There's so much information out there, and I think we have to become comfortable with taking in multiple different positions and multiple different pieces of information, and then trying to synthesize that and making the decision that makes the most sense for us. And sometimes we get very overwhelmed with that, but ultimately, what's best for your kids. And even though a lot of decisions seem like they're huge, they're not usually all that huge, relatively speaking. And so I think we can take in that information, do whatever's best, and just keep reevaluating as we go. And I think a lot of parenting is just reevaluating those decisions as opposed to having to make the right decision right now. And I think we can give ourselves a little bit of grace and some space to take in that information and make the best decision, but not always know exactly what that's going to be, because there's just so much information.
There is so much information. And if I think I know the answer to this question, if someone goes to their pediatrician, the pediatrician is just not willing to have a conversation, what should they do?
I mean, I think if you have questions and they're not willing to talk to you, then you find a different doctor. I think that's something that we just weren't really educated on a long time ago, and you just went to your doctor, and that's fine. But ultimately, if you have questions and they're not willing to talk to you, then you should find someone that is willing to talk to you. And that also starts with, if you're having a new kid or you're finding a new doctor, like, ask questions before. If you are naturally minded, or you want to do, let's say, a slow vaccine schedule or something, don't go to a practice where they don't let you do that.
Yeah.
Like, ask those questions up front, and just say, like, here's my concerns. I would like to discuss this. Are you guys comfortable with that? And some doctors are and some doctors aren't, but you don't want to be at a practice where they don't even want to have a discussion with you if that's what you want. If you want to do the regular CZ schedule, go to that practice. That's fine. But if you don't, or you have questions and they're not even willing to discuss it with you, then it's probably not a good fit for you. So just find a practice, and I guarantee the doctor is just as happy as you are to go somewhere else. They're not like, there's enough patients to go around, so most doctors want you to be happy.
Doctors are very happy when questioning people. Those who don't like questions, they're very happy when they leave. That's such a funny point. But it's like any relationship. If it's not for you, you can't change others. You can only change yourself. So get up and go find somewhere else.
Yeah, but ask questions though. I think that is important. Ask questions. I think that is what's going to change the paradigm. I think parents are changing the paradigm because there's so many more questions being asked.
Moms are changing the paradigm.
They are. There's you see it now. I see it in the chat groups of doctors. Even like a lot of doctors don't know what to do because they're getting so many questions about vaccines and so many questions about natural remedies, and they never learned it, but they're being forced to because people are asking. And if everyone's asking, then you have no choice but to learn.
Oh my God, I love that so much, to know that this grassroots is like forcing people to stay updated if they want to be relevant. Oh my goodness. Dr. Warsh, this was amazing. Where can people find you?
Well, thank you for having me on. And you can find me at Dr. Joel Gator on Instagram or X, or the book Between a Shot and a Hard Place. It's on Amazon or anywhere that books are sold, or theshotbook.com, and then also Substack if you want to kind of get updated, continuous information, newsletters. I put that out. It's been super popular, which has been very exciting. We've been like number one many times on Substack for health, and that's really crazy because I talk about vaccines a lot, but I think people are super interested. So it's been really, really great to see. So it's also called Between a Shot and a Hard Place.
Wait, but where did Gator come from?
So Gator's from my wife. Her last name's Intelligator. So I got Dr.
Wait,
Gator.
Her last name's Intelligator?
Intelligator, yeah.
That is the coolest last name in all of America. Okay, that's pretty cool. That's so cool. Oh my goodness. Well, Dr. Gator. Dr. Joel Gator. Joe Gator, right?
Mm-hmm, correct,
that's amazing. Yeah. Thank you for being here with us today.
Thank you.
Well, that's another episode of the Medical Disruptor. This is what medical disruption looks like. Not blaming, but exposing the limits of the training and pushing the conversation forward. You're part of a community that doesn't exist anywhere else. Be sure to sign up for our newsletter because you're now part of a community that doesn't exist anywhere else. A safe space for people who want real scientific information, but also want to ask the questions without being made to feel crazy. Our community is informed, empowered, and always science-backed. Ready to go deeper? Go to my website, drafratlamandre.com. It has my book, PDFs, newsletter. Until then, keep asking questions, keep asking for more, and keep disrupting.